So I thought the idea of breaking us up and having those sessions, so Marcus from CPH, we had a dentist from India, we had a senior in computer science from Berkeley, and we had two individuals who had just run from molecular biology tumor board to attend the breakout. And so I think it's just a fascinating cross-section. And one of the things that Marcus asked me is, Hugo and JP just prepared this. As a medical doctor, Sunny, how would you view that coming in? And at first I was like, it would be great, Hugo, it's amazing, like I'd love to help your dad. But then it kind of dawned on me that, there are times when that's not always the right answer, right? And for me, I wanted to unpack that internally. And for me, I was talking to Maya about this earlier, it raised something uncomfortable, which is, that's happened. I've had people come in with their function, their superpower, they put it into Dr. ChatGPT, and they have a diagnostic and a therapeutic plan already articulated. And what have I done? I've sometimes anchored on that. And I'm like, I've become a validator rather than an independent assessor. And this goes back, we're sort of ending where we began with what Bob's talking about de-skilling. And I had a conversation with Maya and Hugo, and Maya's dad, Dr. Peterson, is what we call a doctor's doctor. It's the kind of doc that, if I wanted to send my mom to someone, I would call Dr. Peterson. He's a master clinician. And we kind of wondered aloud whether that era of a master clinician is going away. And to Hugo, I'm interested to unpack this with you. My tension with what's happening is that I worry about my ability to doctor in the same way. Like, I don't know if I'm going to be the doctor's doctor in this era. And to Dan Lowenstein's point earlier about the seizure meds, I don't actually know if that's necessary, but that has fundamentally changed the way that I conceptualize myself, my identity as a clinician. And that brought me back to something Bob said. I work on hypertension. I actually work in a clinic. I work in the same clinic as Ida, and I also work at the UC system and thinking about blood pressure control. Bob had said, and I think I almost quote, we don't need primary care doctors for blood pressure, cholesterol management, or Wegovy access. And that's interesting. And that's interesting, right? And there's a part of me that agrees, but then a part of me is fearful about that.